and try it for
Good morning, everyone.
We got a great show for you guys today. We got a 2-hour show, so we're going to be going through a lot of different stuff. So leave your comments, questions, anything like that if you have them.
Good morning, everyone. This is the Wellness Radio with Doctors Warren. I am Dr. Rebecca Warren, and I'm here with Dr. Nathan Warren.
Woohoo! We're excited. We got a 2-hour show for you guys today, so it's going to be amazing. We're going to be going through many different topics. It's going to be fantastic. It's going to be some fun stuff. We're going to go anywhere from dental dangers and infection all the way to the hidden causes of autoimmune and Hashimoto's and all kinds of fun stuff. So make sure that you stay tuned throughout the show. But if for some reason you got to miss some of it, guys, you can always go to doctorswarren.com. That's doctorswarren.com, and you can actually watch our radio shows. We archive them there. Or you can, even better, I think, follow us and like us on Facebook at Doctors Warren, DRSWARREN. And you can follow, you can see when we go live. You can see our beautiful faces right now. Maybe more of our morning faces, since our alarm clock didn't wake us up today.
Your alarm clock, as in our 3-year-old.
My 3-year-old, yeah. Usually he's like up right on the dot. It's like, oh, it hits 7:30, boom, he's up. So we're like, I'll set my just in case alarm, for like 9:40.
You didn't. 9:40.
Yeah, no, it's like a just in case, like if the world is about to end type, alarm clock. Expecting that, Elijah's going to wake up, and he did not. He slept in.
Well, we learned our lesson today.
It was good, though. Well,
good. Guys, if this is your first time tuning in, this is the Wellness Radio. We are doctors of chiropractic, and we work with functional medicine techniques to bring functional wellness to every single person that we coach and encounter. So our goal is to educate, empower, and engage. If we can give you the right information, the real, true information about what it looks like to get well, if we can empower you to take those action steps and then be engaged in our Doctors Warren community, we know that your life can be completely transformed. And so we're here every Saturday morning from 10 to 11. But this morning we have a special 2-hour show, so we'll be here from 10 to 12. There you go. That was hard for me. And so we're going to be talking about a wide range of topics, because in this past week, what we love to do is whatever our practice members, whatever our Facebook followers are asking us, are commenting, we kind of make a mental note or we put it in our phones to make sure that we get on here and we discuss those topics so that everyone can hear exactly, because you probably have those same questions. And so just a little bit about our background story as we jump in there. Dr. Nathan and myself, we do this because our lives were transformed by that. At 19 years old, I was diagnosed with thyroid cancer, and they say that's a good cancer to have because they can just cut out this vital organ and then put you on a medication, and then you automatically assume that just because you cut something out or you radiate or you medicate something that you're going to be well. But you're never going to medicate, radiate, poison yourself to health. You're never going to cut your organs out to health. If that's your goal, if you're going to be cutting out your gallbladder, your appendix, your thyroid, your ovaries, your uterus, you're just going to have to keep on cutting crap out, because that's just never going to get you to health. And the reason why is because an unhealthy body, a body that's imbalanced, a body that's dysfunctional and dysregulated will cause symptoms and dysfunction. And you can remove the diseased area, but guess what tends to happen? You will see disease show up in other areas because the body
always happens. Yeah.
Yeah, right. Yeah, not often, always. But so for me, I got my thyroid cut out, and I had to struggle for years with these hormone issues, with thyroid issues, even though I didn't have a thyroid. So I still struggled with a lot of the thyroid issues that people are coming in to see me for their thyroid. And it wasn't until I had to draw a line in the sand and I dug into the research. And so before I ever became a doctor, I said, no doctor is going to know more about my own health than me. And I went all out and I completely transformed my health. And that's why I can really coach people to reclaim their health when they've been diagnosed with a thyroid disorder. It's because not only am I a doctor, not only do I look at the research and the articles, but I've lived it. I've lived it myself, and there's something different. There's a compassion there. There's no ego. You wouldn't believe how many times I have practice members going to their GP asking for labs, and they are just angry, and they say no, and you can't have that lab, and da-da-da-da. That's ego, and ego is never going to get you well. I mean, when people have pride and they want to be stuck in the same dogma, you don't get well.
Yeah.
And that's what's a big issue within medicine. So our goal is, whether it's thyroid issues, estrogen, sex hormone, testosterone issues, whether it's back pain, headaches, whether it's migraines, allergies here in Chattanooga, the goal is this. We are successful when you get well. We are successful when people get well. We have a successful radio show, and you can take this information and do something about it and transform your health. But the thing about this, pharmaceutical companies, insurance companies, even the medical model, they are only successful if you are sick.
Yep.
So if you want to continue in that same path, continue doing the same things, and that's where you're going to end up.
Yep.
And so our goal is to encourage, to engage, to educate, and to empower you.
Yeah, I always love it too, because it's like we, I don't know if you've ever seen like the like sick or hurt dog that, keeps going back to its bad owner over and over and over again, even though they've been mean to them, they've starved them, they haven't done anything right. Guys, you guys do the same thing in the medical model. You're like, oh, my doctor's only cut out my gallbladder and my thyroid.
Nice.
But I played golf with him on Sunday. Or I had a patient come in recently that was like, oh man, you know what? No, I see my 25-degree scoliosis in my lower back. Yeah, I see the degeneration. Oh man, yep. Yeah, I see the 45 millimeters of forward head posture and the bone spurs forming there. Man, yeah, it makes so much sense. I'm going to go ask my ortho if this is, a good thing that I should do. I'm like, so you're going to ask somebody who has zero, absolutely no experience, no knowledge, no, clinical expertise on how to actually correct a spine, what you should be doing about that. I said, what is his job? Well, he's a surgeon. What? Okay, so that means what is he gonna suggest? Surgery. Is that what you want? No. Then why are you going to see him? Like, guys, we have to start using logic. It's unbelievable how many people I see that do that. Or it's like, man, my kid's got a stuffy nose, got to send him to a pediatrician, right? We got to find out what's going on with him with that stuffy nose, rather than saying, hey, wait a second, what if I do these things to support the body? What if I say, hey, you know what, let's do some things that are going to boost his immune system, vitamin C, vitamin D, things like astragalus, different types of, immunomushrooms and complex and things like that are going to get somebody well, rather than saying, oh, I'm going to run to the pediatrician. What does a pediatrician give every sick kid on the stinking planet?
Antibiotics.
Freaking antibiotics, dude. It's unbelievable. And actually, we just found out, I didn't know this, right, that tubes, right, that they put in kids' ears. I had no idea. They're either made of one, really degrading plastic, or number two, they're made of Teflon.
Something that never degrades.
Wow.
So think about that. Like we do things, we do things just because it's always been done, and we never ask questions. And so, a simple thing that it just hit me yesterday, we're working with children that guts are a mess, and they're really toxic, and we're seeing some really, really great results, but we're also working with, adults that are really toxic. And so as doctors that are looking at preventative ways for our wellness, practice members that have been with us for a few years, we look at these people that are coming in and they're really, really sick, and we think to ourselves, what could we teach? What could we do differently? What can we encourage people to do? And one thing that really hit me was that tubes in ears for chronic ear infections, which is an immune issue, it is a gut issue. I mean, it is a symptom of a body that needs support, not more and more and more medication. And the reason why we know that is because we see such great results with the resolutions. I mean, we had a little baby not too long ago where the mom was just so overwhelmed, just was having ear infections like every 2 weeks from like November to like January, February.
6 rounds of antibiotics. They couldn't give her another one.
Yeah, and so they were like, listen, we have they came in to see us, and she was like, my husband, we already made a decision, we're getting tubes in her ears like in 2 weeks or whatever. And we asked the dad to come in. We sat down with dad, mom, and we said, give us 30 days. Just give us 30 days. Do what we recommend and give us 30 days. and that little girl has not had an ear infection since.
Actually, yeah, and her grandmother is still in the office, right?
Yeah.
They have since moved, and it's been a year and a half, and she still has had no
Zero
ear
ear
infection.
infections.
None.
And so it's answering a red flag. It's answering a call that's saying that something's wrong. But think about this. One thing we do know that's an endocrine disruptor, that is a hormone disruptor, is chemicals found in plastic. This isn't a big surprise. Like, it is in the research studies, it's there.
Mm-hmm.
That plastic, BPA, BPS, phthalates, POPs, like there's so many different chemicals. I mean, people are freaking out because we're being exposed to so much plastic. Yeah. And plastic comes in and it disrupts our endocrine system. And then the one thing that even the EPA, maybe not Trump's EPA, but the EPA before now, what they acknowledged is that, holy crap, there's this chemical by DuPont that never breaks down. It never breaks down. Like they say that, every single American has this chemical in their system, in their blood, in their bodies, and they don't even know what that's doing long term. And yet when a kid gets an ear infection, antibiotic, which it has shown in studies that antibiotic will set you up to have more ear infections, especially if the ear infection is viral. That doesn't even apply. But anyway, so these tubes in your ears are made of plastic and Teflon, and they're right there. They're surrounded by tissue. They're warmed by the child's body, and God forbid the kid has a fever, they're warmed even more, and they're right by their brain. What do you think that's gonna do? I mean, like a plastic in your head, that's just wild.
Yeah, but it's only a little thing, right? Not a big deal. Well, I literally learned that yesterday. I had no idea. That what those things were made of. And again, the dangers of Teflon. Like, when you were reading that to me, I couldn't believe it. We're talking literally PhD physiologists from Berkeley are talking about how they literally use the words, the most toxic substance known to man that never degrades. Like, those are the words they used when they were talking about PFOA and Teflon, and absolutely blew my mind, because I knew it was bad, but to that point, it doesn't degrade in the body, right?
It's wild.
He said it could take literally decades upon decades for the body to even try to push it out. It's wild. But anyway, we're going to dive into more of that, once we get past the break. So.
And after this break, we're going to talk about one of our show sponsors that I'm really excited about this, guys. We especially live here locally in Chattanooga, and we'll start doing this for people all over the U.S. that follow us. But we get asked for really great businesses or doctors to visit. And we're going to tell you about an amazing dental practice and why what you do in your teeth matters to your overall health. And so that's what we're going to be talking about on this next segment. Right now on our Facebook Live on Doctors More, and people are already asking us questions. So if you have any questions, make sure you find us on there. You can watch this video later. This is The Wellness Radio. We'll see you right after the break. All righty.
All right, we got some questions here.
So Nancy said, "This is awesome, guys. I'm going to have to listen to the rest later. Thank you for sharing the information.
Yeah,
I'm so
you,
glad.
Nancy. Good morning."
And then Mallory said, "What about fluid in the ear? I know some kids have fluid in their ears that will not go away. Doesn't cause infection, but does cause them to fail their hearing test. Which the concern there is language development. Is there something to do for that?"
Yeah,
I'm asking.
Yeah, so the biggest thing that I find is again the chiropractic adjustment, because it does two different things. It's not only going to it's not only going to kind of set up the eustachian tubes to drain, but more importantly, what it's going to do is it's actually going to trigger the parasympathetic nervous system, which in turn is going to again rest and digest, allow the immune system to come in there and clean it up. So I'm a huge fan of that first and foremost. And so I'll have some people, well, I've tried chiropractic, adjustment before for ear infections. I'm like, no, that means you didn't try it enough. Like, sometimes, especially if a baby has some pretty severe subluxation from things like birth or birth trauma, or again, maybe it's a fall right after birth, whatever that is. Again, yeah, maybe it's going to be consistent chiropractic care for the baby. And so, like with the one you just talked about with one of our patients about a year and a half ago that we were working with, little girl, we were able to get her from 6 rounds of antibiotics and chronic ear infections to none, and it's been like I said, over a year and a half, and still none. But guess what? I saw her like 2 to 3 times at the beginning for like a month, because guess what? She was like, she told the dad, give us 30 days. I want 30 days. So I was like, man, I'm going to make sure. I like how you said
she told the dad. I mean, I did.
But you did. You were like, no, give me 30 days. I mean, it was actually pretty amazing, because Dr. Rebecca went into the room, because he was a big skeptic. Dr. Rebecca went in the room and was like, listen, you know, I can get, like, we can get her well. Like, we can make sure that she's going to get well. We're going to get her adjusted. She's going to get better. Give me 30 days. It was such amazing confidence. And so anyway, you have to do it more than just once every month, right? Like, I mean, maybe in wellness and maintenance with a kid, but again, from my experience, especially watching my kids at home, like, you know, you've got to really give yourself the advantage.
My kids get adjusted about once a week because they fight and they fall.
Yep.
The other thing is this. So with fluid in the ear, the thing you have to acknowledge is that the child wasn't born with this. I mean, if there's a structural abnormality, you would have known in utero,
like
or you would have known,
or things like that.
Or like Down syndrome can have it, but like, the fact is, this child is in training, so it means that it's something that's caused, and it's not because of lack of tubes in the ears. It's because, number one, you need assistance with draining, which is what chiropractic does, removes the interference.
Yep.
And number two, the immune system needs to be worked on. And most oftentimes when kids are younger, we see little signs of like gut issues, like a little bit of colic here, maybe some rash or diaper rashes here, when really those are all kind of red flags that the gut microbiome is a little imbalanced. And for kids, a little bit goes a long way, but a little bit also means you can heal it quickly.
Yep.
But between the immune system and removing kind of the fluid with function, like influencing function through the chiropractic adjustment, helps a lot. So it's twofold. And if we had that issue with our kid, that's what we would be doing.
Yep.
Probably like twice a week until until their immune system is stronger.
Yep. All right, guys, welcome back to Wellness Radio. I'm your health expert, Dr. Nathan Warren. I'm here with even more of a health expert, Dr. Rebecca Warren. But we're talking about, we actually got into this last segment kind of on ear infections. We had some questions on Facebook about ear infections and like, what can we do? What are some things that can be done? We talked about really a lot of consistent chiropractic care for, you know, ear infections. Some other ones though that I want to mention is, you know, and you talked about gut issues, right? Really getting down the root cause. Another one that I find is histamine reaction, right? So the child is constantly having histamine reaction to different allergens that's out there. So you can do some things like quercetin and nettles from like Designs for Health has a good safe one that you can use for kids. You know, there's other types of like mucosal enzymes that you can use as well. But you know, again, histamine reaction is another one. And you can support like downstream pathways like methylation and homocysteine levels. So, you know, those are some things that I might try.
Yeah, and so back to, you know, everything that we do, no matter what dysfunction or irregularity or symptom that you have going on, one thing that we do that is very revolutionarily different when people come in and sit down with us is we ask why, and we get down to the cause. And we start with this premise that the body's created to heal. And so the body's created to heal, and this is something that you developed, then it's something that can be undeveloped. It was cause. There's a cause and an effect.
Yep.
And if there's a cause and an effect, people just live with the effect and deal with the effect. And you never take a second to go back to the cause. And so even with kids in ear infection, there's a cause to ear infection. There's a cause to fluid in the ear. From, you know, the birthing process to the immune system in the gut. You know, number one, it takes time. Number two, you got to heal the immune system, boost the immune system, and allow the function to be balanced through the nervous system, from the brain down the spinal cord out through your nerves. And again, we see some amazing results, but you just got to give it time. And you know, Mallory, I know someone asked this on our Facebook video here about that, and that's what it comes down to. And so, guys, no matter where you're at in your health journey, whether, you know, I have women that come in and they're like, you know, I got a hysterectomy. Well, you know, usually it starts off where, you know, I'm on, you know, hormone medication, I'm on bioidentical hormones, I'm on hormone replacement, and I just want to feel better. But that's not the problem. The problem isn't that right now you're on hormone replacement. The problem is that what happened before the hormone replacement. Well, I had a hysterectomy. Well, why did you have a hysterectomy? Well, because I was having really bad, you know, I just one of my new coaching clients, this was our conversation. Hysterectomy, why? Well, I was having some bladder issues, but also they said it was going to help. Help what? Oh, I had hormone issues. I had endometriosis. All they did was they would scrape it up and it would keep on coming back, and I had really bad painful cycles. And so, well, just cutting out this uterus and your ovaries is never going to get you to health, and that's why you're here. It's not that, okay, you're right here, how do we deal with this? We still have to go back to the fact that you had such severe hormone imbalance that you were having heavy, painful, irregular periods. So that's the problem that we're still going to address. And when you address that problem and you balance out the hormones that cause that problem, number one, I do have people that end up canceling their hysterectomy, like don't get hysterectomies. But even if you get it, now you can actually feel like a difference in your body. You actually love the body you're in because you feel more balanced. You're not out of control. You don't feel like anxious and weepy and all these things, which are all hormone issues. But that also goes for men as well. I had a man in my office, and this is what our job is, sitting across from me talking about, I'm just here for pain and for back pain. So I asked him, okay, so what's stopping you from reaching your health goals? Well, I can't, I'm going to the gym and I just feel like I need to lose weight before I go to the gym. And I can hear in his voice this kind of like lack of energy, like this lack of drive. And guess what I have to say to him without him telling me? I go, what are your testosterone levels? Oh, well, it's, low, borderline low, and doctor says we're going to wait and see. What are they going to wait and see for? Until it gets severe enough? Yeah, until you need, like, testosterone injections? No, the way you're feeling, those emotions, that's not normal for you. And having low testosterone and getting, shot up with testosterone isn't going to correct that. All that's going to do is give you some more complications later down the road. Right? Yeah, it's symptom relief. So then we have to take a step back. Okay, so when did this start? Then you can support the body to heal and to function. And so if you guys are listening to this and you're like, no, my grandkids has ear infections, or I have these hormone issues, or my wife has these hormone issues, my daughter, or, I'm in pain, headaches, back pain, low back pain. Guys, this is what we do. We do that locally here in Chattanooga, in Hamilton Place, or we do it virtually. We have clients all over the U.S., so you can make an appointment to see us in the clinic or do it virtually. Give us a call, get an appointment time for the 2-hour show. We have 5 appointment times. Mm-hmm. 5. Once they're gone, they're gone. We added a few more here for the Labor Day weekend. So give the girls a call. That number is 423-362-5360. Again, that's 423-362-5360. And I will say we decided to extend the special. Mm-hmm. Usually that appointment can be between $120 and $150. But if you guys call and get one of those 5 appointment times, you can get it for $60. So give us a call.
Man, I just realized I'm like slurping on my smoothie and I'm on the radio. That's probably super annoying. I was trying to get this last little bit out because it's super good, and I'm like sitting here slurping on the radio. But
should have just punched it out of your hand.
Yeah, you should have just completely done that, right? But anyway, I thought that was you made a really really good point with taking somebody and hopefully all you guys listen on Facebook Live, on the radio, you guys need to kind of understand this principle here is that we're not always looking for just symptom relief, right? Mm-hmm. But we live in a society that's all they look at, right? You go into the doctor with, let's say, a rash on your arm. What do? They refer you out to a dermatologist. What does a dermatologist do? Well, what can we do to make that rash go away? Instead of asking, what is it that caused the rash to get there? And almost 100% of the time, it's going to be coming from the gut. And what do they do for the gut? Not only do they not do anything for the gut, but then they give you steroid creams and all kinds of different medications that actually disrupt your microbiome even more. Really interesting thing. New study that just came out. I got to talk about it because it blew my mind. This is a study where what they did is they actually looked at different bacteria. So they looked at over 72 different species of bacteria that could live in the human gut, right? And they exposed them to 90-something different medications. Oh my gosh. You realize each gut bacteria would change that medication just in its own unique way, which would then affect bacteria B in a different way, which would then affect bacteria C in a different way. So guess what that means? Every medication, I don't care what it is, I don't care if it's Tylenol, aspirin, I don't care if it's oxycodone, I don't care if it's fentanyl, I don't care if it's a high blood pressure medication, I don't care if you've taken the drug for 15 years. Every drug that you put in your mouth, they have no clue what it's going to do inside of you. That's what the study shows. They have zero idea
That's crazy.
what that drug is going to do inside of you because
term.
of the biodiversity of your microbiota, because of the gut bacteria, the viruses, you know, the pathogen, some of the pathogens that are actually supposed to be. All of these things that make up your microbiome literally change the effect of those drugs.
That's wild. And that, you know what that actually makes me think about, because in this segment we were supposed to talk about dental care. The other thing that makes me think about is, like, you know, we do a lot with helping people heal their gut. So we'll do like stool testing that really looks, I mean, some incredible results from these stool tests at looking at their gut microbiome imbalance. And what we know through the research, this is what we know about the research on the gut microbiome. They're starting to realize, oh crap, there is a lot here. From fibromyalgia to depression to cancer. Like, whoa, there is a lot here. The second thing they're realizing is, whoa, we're just starting to scratch the surface. Then why the crap do we have, when we go in, you know, to our doctors or even to dental appointments, we could be taking antibiotics every 6 months for a dental cleaning. Now, don't get me wrong, I'm not going to go into that. I'm not going to go into, like, you know, if you have like a knee replacement and your teeth and all of this. But think about that. Think about the fact that your gut microbiome holds your entire immune system. And you go in, you're getting chemicals in your mouth, you're getting fluoride all in your mouth, on your teeth, you're getting, you know, mercury in your mouth, and then you're taking antibiotics just to have like a cleaning with all these chemicals, and you're, you know, absorbing that in. God forbid you swallow it. Like, this is, well, you're swallowing the antibiotic, and we don't even know long term what that's doing. In fact, the issues that you're having right now could be all contributed to all that stinking antibiotic use that you had. And so that's why we're actually really excited. We found an amazing dentist here in Chattanooga, Smiles of Chattanooga, Dr. Gallion and Dr. Aaron. We have referred people in our office that have needed like dental procedures done to help with their overall health. And it's been amazing. And so that's actually one of our first community partners. Well, actually, Sisu Sana was our first one. And we're so excited to be talking about like our experience there. So we're going to go on a break here for the Wellness Radio. And when we come back, we're going to talk about how to, you know, navigate through, you know, your dental health and how that can be, you know, tied into your overall health. And if you guys want one of those 5 appointment times instead of, you know, between a $120 and $150, you can get it for $60 right now. Give us a call. That number is 423-362-5360.
All right, guys. So yeah, we're about to get into one of my favorite / most annoying / I hate that I have to know as much as I know about dental health. All right, and the dangers of dental. And this is, man, you guys have no idea the journey that we've been on over the last like year and a half, navigating like my patients and my clients with serious health issues, and again relating it all back to the mouth. I mean, it's absolutely wild. I don't know if you guys, you know, there's certain, you know, what was it, The Root Cause that came out. I don't know if you guys saw that movie. Before they took it, they pulled it off of I think it was Netflix or Amazon Prime, I can't remember, but The Root Cause, they pulled it off because it was making such a dramatic impact, and all these dentists across the, you know, the across America were like, no, root canals are fine. But of course you're going to say that that's fine because you've already done like 1,000 of them, and God forbid that you have to go back and say, whoa, you know what, maybe I was wrong about that procedure, maybe it's not right, maybe it actually makes sense. That could it be that it doesn't work because it's the only procedure that we have in all of our, you know, in American surgical technique that actually leaves a dead organ inside of the body, inside of a living body? It makes no sense. Root canals make zero sense. And again, what I'm finding is I have so many patients and clients that actually have had root canals, and we go back, we do a 3D cone beam x-ray, and they've got massive cavitations, which are infection into the jaw that is literally wreaking havoc on their immune system 24/7. And so as we dive into this, guys, dental health goes far beyond, you know, again, just brushing your teeth twice a day and expecting that your teeth are going to be just fine. It is that important that you are taking care of your dental health, that you're taking care of your kids' dental health, and you're doing it appropriately. Listen, taking care of your dental health is not just putting fluoride on the teeth. I don't care what your dental hygienist said. I don't really even care what your dentist said. Again, that right there, that's dogma, not science. that shows that fluoride is going to be, it's like you had one or two studies back in like the 1950s that said, oh, fluoride's good, just so again that you could get fluoride out to the masses. I'll promise you right now, I haven't used fluoride on my teeth in literally 5 or 6 years. Actually, it's probably been like 12 years actually since I started chiropractic care in Josh Axe's office a long time ago. But anyway, once I did that, I stopped doing it, and all of my dental appointments that I've ever been to, my dentist is like, man, your teeth look amazing. Actually, your x-rays have improved, your teeth, again, they're stronger, the enamel's stronger, everything is improved. And I haven't used fluoride, a drop of it since then. And again, there's literally millions of Americans who are finally saying, oh, you know what, that's actually true. And so again, we're gonna dive into all of those facts on dental danger, so hang in there, okay? All right, guys, welcome back to Wellness Radio. I am your health expert, Dr. Nathan Warren, and I'm here with my beautiful wife, Dr. Rebecca Warren. And so we've been talking about, in the first segments, we talked about, we actually dove into a little bit into ear infection and some things like that. Now we're diving into dental dangers and how to actually navigate the water in your dental practice. And so on Facebook Live, I was actually just talking, I went off on a little bit of a rant about what dental health and again, man, the ADA. The ADA is like just as bad as the American Medical Association. It's like, I look at those two as, man, if we could get rid of those two organizations, we would probably be so much healthier, as a population. Because the ADA is still they're still like standing strong in the fact that they're saying, oh no, amalgam fillings, no, they're fine. It's toxic before we put it in the mouth, and it's toxic after we put it in the mouth. But when we put it in the mouth, it's totally stable. It's fine. And it's like, that's absolutely insanity. Like, and I'll never forget that document that you pulled up, and we'll have to, maybe we can post that on underneath the this Facebook Live here. She actually pulled up it was like a 14-page document. It was actually the document they used to ban mercury fillings from being used in the European Union. And it was like, how many peer-reviewed studies did it have back? Like 428.
I couldn't print out the whole thing.
Gosh.
I was like, I'm not going to print out all these citations.
It was like 2 pages of like a written article, and there was like 428 peer-reviewed citations on the damages of amalgam fillings and mercury fillings. And I look at that, and I'm like, how can you still be a dentist practicing and not say that mercury fillings can damage your body? Like, I don't even know. Like, to me, I question your intelligence when you say something like that. Because, again, when we look at the dangers that it does inside of the body, it's absolutely nuts. We know that, again, it actually affects. So you take something like mercury, guess what? Not even your bacteria are going to live in that environment. So we know on a daily basis, if you have a metal filling right now in your mouth, you have a mercury filling right now in your mouth, and more than likely it's 51% mercury, and again, it has other metals in it too, like things like cadmium and other things. And so anyway, every time that's in your mouth, every single day, you are disrupting your microbiota. You are disrupting your microbiome. You cannot have a properly functioning microbiome.
Go on YouTube and look up the IAOMT posted a video, and it's called Smoking Teeth. I'll see if I can post that on our Facebook page. Go ahead and take a look at what they did with like a tooth with the filling that's on it.
But wait, we didn't believe that. People didn't believe that until who did? Oh, then Dr. Oz comes out and does it. And now all of a sudden people, oh, wait a second, maybe it does work that way.
Yeah.
All you need is Dr. Oz to do it a little bit.
I like Dr. Oz.
I do too.
I used to hate on him. I'm like, hey, he's putting out some information out there, and he's a cardiologist.
For sure.
But the big thing is this, like your dental health, your wellness. I mean, sometimes like when Dr. Nathan started looking at the research and started listening to a lot of dentists speak, this is just what he did. I was like, dude, you should just go be a dentist, because you were so excited to learn about this.
I was mad, really, to learn about it. Our patients and clients forced us into learning about it, because they, you do all these things with them, and they don't quite get, well like you want them to, and then you look in the mouth and boom, it's like the magic happens.
Yeah, and so one of the first places we started, and the first place we got exposed to understanding how our dental health actually points a lot to our overall health is Weston A. Price.
Yep. Oh, yeah.
And Weston A. Price was a dentist.
My heroes.
Yeah, you want to touch base about him?
Yeah, so Weston A. Price, he was a dentist, but he traveled all around the world. This was back in I believe it was the early, 20s, 30s, somewhere around in there. I could be wrong with that, so don't quote me on that. But anyway, traveled around the world, and he looked at different civilizations, different societies, and he looked at their jaw shape and their teeth. And what he noticed is here are these societies who've never once encountered a dentist, never once even, brushed their teeth traditionally, and yet their jaws were perfectly, square aligned, very symmetrical, and their teeth were white and perfect.
You could still see that, when you see pictures of children in other countries, developing countries. One thing you're not seeing is this rotting out teeth. So why is it that these children that don't have access to, dental cleanings every 6 months, or these kids that are just not possibly even brushing their teeth, how is it that their teeth are so, bright and strong and healthy, and we're seeing cavities and issues here with kids?
And I do have to say, because I said that argument one time to somebody about 2 months ago, and they're like, no, I've been to third world countries and I've seen the kids' teeth are rotting out. And I said, yeah, but what did you bring those kids as a present? And they're like, oh, candy. I'm like, yeah, because we've exposed them to all the crap that we have here. It's even these kids that are living in civilizations where we haven't brought in Snickers bars and Milky Ways because we think we're helping them by bringing those things, they're missing out on life, without those things. You still see them with really good teeth. And then we infiltrate them with all of our amazing Western stuff that we have available, like Milky Ways and Snicker bars. And next thing you know, now their teeth are starting to rot out. And so Weston A. Price was one of the first ones to actually point that out. And what's unbelievable, so he said, literally, wait a second, your nutrition has so much to do with the shape of your jaw and the way that your teeth are.
And not even just the shape, even the shape of women's pelvis, their pelvis size, which the pelvis size makes it easier to birth babies, the overall body structure, the growth, everything came back to the fact that what we were putting inside of our mouth is making, we're not just talking about sugar.
No.
We're talking about the fats, the bad fats, the rancid fats. We're talking about the really processed foods. And this is a big deal because your dental health, your dental wellness is going to influence your overall wellness. You cannot have a sick mouth and have a healthy body.
Yep.
There's no way. And also, the thing to realize too, we think about the gut microbiome as just the gut, but it begins in the mouth. You have a whole colonies of bacteria in your mouth that are there to exist, and there needs to be a balance, but we're killing that out. We're putting these Listerine chemical blue dyes in our mouths, then we're putting all this fluoride in our mouth, then we're drinking fluoride, then we're going to go eat some McDonald's and have a milkshade.
Yeah.
That's just not.
We wonder why we need dentures at 50 years old.
Yeah, so in the end, we want you to take care of your dental health, but we want you to start asking questions. Start asking what your body's being exposed to, because we see some serious toxicity issues that see some light of day, see some progress when they go in there and they clean up root canals, or they get their amalgam removed safely.
Yeah, safely. That's the key word.
Come on, even at least dentists say, hey, the highest exposure to mercury, like what you said, is when you put them in and when you take them out. So that means you should be doing a rubber dam, a vacuum. You should be protecting yourself as much as possible. So I will say you could imagine us going out to eat, or going to, if we need to go to the emergency room, or going to a dentist. You could only imagine the type of questions we ask and how we interview them and how we but I'm really excited. I went to Dr. Dalian here in Smiles of Chattanooga, and I just fell in love with everyone there. The way they run the office, the ladies there are amazing. And then I didn't stop talking about it for months.
She's she came back and she's like, okay, we need to run our office just like this. It runs
they made you feel amazing. There isn't a lot of places. Ask me if I want a warm blanket.
It's
guys,
amazing.
It's amazing. And so there isn't a lot of places where you feel comfortable, especially at the dentist. I know. Yeah. I don't always feel comfortable. I like going to the dentist, but there. And so I made Dr. Nathan go in and meet him, and Dr. Aaron from. So I wanted to share about this office because. I want to celebrate businesses within Chattanooga that are treating people well, that are respecting you, that are listening to you, that are providing high care. And I know we've talked about Sisu Sauna in the past. That's a sauna, infrared sauna place we absolutely love. But Dr. Gallion at Smalls in Chattanooga, gosh, I mean, I would go in and do stuff because I like it.
I'd say we probably have a very, very rigorous process to become a community partner of us, because we go and we check out the, I mean, literally, this is months that we've known about this, actually maybe over a year, but again, we want to make sure that we learn about, somebody before we actually recommend them, and yeah, I'm telling you, number one, you're going to get, like, the customer service you get is just, there's nothing better, I don't think. It's absolutely amazing. Maybe besides our office that you get, but again, absolutely amazing. But what I love about them is that, number one, they listen to you, right? They actually listen. They listen to you. Like, if I have a patient, I don't know, I think it's amazing though, right? If I have a patient, I'm like, hey, tell them you come from my office. Tell them this is what you want to do. This is what I want you to say. And they go in there and they say it. And guess what they do? They do it. They listen. They're like, hey, I'm like, hey, don't you, like, try not to use fluoride for your cleaning? And they go in there, and guess what they do? They don't use fluoride when
they have
a
lot of different. They're just really great. So we wanted to talk about that because we can't talk about dental stuff without giving you guys resources. Yeah. I think they see them as young as 2 or 3. If they can just sit there, they'll work with them. But that's what we love. And I wanted, before we go on break, this comment on Facebook, I thought was really interesting because we didn't even get into this in regards to dental health. She said, I read once, also because kids are eating a lot of mushy food and not biting an apple or celery, it affects them having strength in their teeth. Mm-hmm. I mean, think about that. I think about that too. So, like, if a child in another country was never brushing their teeth, what types of foods are they eating that are naturally more coarse, that are rubbing off plaque, that are moving things along? A lot of root vegetables, possibly, a lot of tubers.
And also, as you push, right? Like, even in a proper breathing, we'll get into this in the next segment, but as you push, when you bite on a harder food like that, you actually spread out the teeth, right? And you create open, wider jaw. You change the jaw shape.
Huge.
Right?
How awesome is that? Well, guys, this is the Wellness Radio. This is our last break. So when we get back, we're going to wrap up talking about dental health, and Dr. Nathan's going to go on a few more rants, and we'll see you right after the break.
Yeah, so that's a really, really amazing comment for sure, like looking at, eating harder foods. That's why Dr. Rebecca and I, we did baby-led weaning? Mm-hmm. Is that what it's called? Baby-led weaning. And we, so people thought we were insane when we just, gave our kid, a carrot, for them to eat on, or, we gave them, God forbid you give them a grape, I think that's but again, we were safe with them, we watched them and everything, but they did baby-led weaning so that, again, they can learn 2 things. Number one, they can actually bite on real food, right? Develop the muscles of the jaw, develop the spacing of their teeth, but then also, number 2, they actually work on their own gag reflex, right? If they don't get a chance to work on their own gag reflex, that's where you get into major dangers later on with kids choking on food because they haven't actually developed that very well. So here's the thing, guys. Your teeth, it literally, your health, is going to start here. I would even say, actually, it starts a little bit above that, right, with your nasal cavity and everything. I think that's actually your first place for your microbiome, because we're supposed to have an actual microbiota built up in the nose. That's why using something like Restore Nasal Spray is such an amazing thing that you can use, because it helps to build up the microbiome there. But in the mouth, think about the mouth for just a second. Think about what we do in the alternative realm and even in the natural realm, right? Think about this. What is our goal, right? You look on the conventional realm, right? We look over here, and what do? They use things like fluoride. They use fluoride toothpaste. They use all these different killers of bacteria. Then you wash your mouth out with some type of, mouthwash that kills 99.9% of bacteria. So literally their goal is to kill bacteria, right? Then we come over here, right? Even in the natural and alternative realm, and we say what? Well, we're not going to use fluoride and harsh chemicals like that, but we're going to use xylitol, and we're going to use some of these other things like tea tree oil and oil, like oil of oregano, and we're going to use some of these that are also antimicrobial, and they are killing bacteria. So both sides, our goal is to kill bacteria, and we're fighting the wrong war, guys. If bacteria and viruses were just out there always, every single time trying to kill us, guys, we've been dead a long time ago. There's supposed to be a symbiotic relationship inside of the body. So guess what that means for the mouth? There is supposed to be good microorganisms, a great diversity and balance in the mouth. And did you know when you get that microbiome in the mouth set up, guys, that's when you don't have to worry about things like cavities. That's when you get to actually experience strong teeth. That's when you actually don't have to experience like the biofilm that builds up on the teeth that you guys get at the end of every day. And so we have to do things a little bit different. Number one, it starts with the foods that we're putting into our bodies. That's why we talk so much about a paleo lifestyle and eating real food and avoiding things like, rancid oils, grains, sugars, things like that. So we're going to dive a little bit more into that. All right, guys, welcome back to Wellness Radio. I am your health expert, Dr. Nathan Warren. I'm here with my beautiful wife, Dr. Rebecca Warren.
Morning.
And man, we started talking about a subject that I'm pretty passionate about, not necessarily because I would ever really want to work with somebody's teeth, but because I recognize just how important it is and how much it's been ignored. Sometimes I'm like, man, I wish I could grab like every dentist, in America and just shake him and be like, do you realize like you are one of the primary gateways to somebody's health? Like, do you actually realize that? And like, huge. If you knew the power that you have in your hand, the way that you would treat every single patient, it's mind blowing, And so one of the things I was talking about on Facebook Live just a second ago is the proper microbiome of the oral, cavity. And so I talked about how even in the alternative and natural realm, the goal is still trying to kill bacteria. And we're missing the whole boat there because, again, it all starts from building up a healthy microbiome. When you see those things like, you see Lysol sprays like during flu season, kills 99.9% of the flu germ or whatever. And then you see, same thing with like Listerine and all these other things, kills 99%. Do you know what the 0.1% that's left over is? It's not good bacteria, it's pathogens. And guess what they do? They replicate. And so again,
mutate.
That's why one of the most unhealthy places that you can be is where? In a stinking hospital where they sterilize everything. And so again, our microbiome is so vastly important. We're not meant to kill all bacteria and all viruses that are on our. We're meant to live with a symbiotic relationship, but doing it in a safe and effective way. Right? Mm-hmm. And so to me, just like with Weston A. Price, it all starts from what we're bringing into the body, right? What we're actually eating, what we're chewing on, what we're digesting. It starts with that. If you do not have that foundational principle like actually set and cared about, you will not be successful. You just won't. I don't know any other way to put it. You can't eat McDonald's and Pizza Hut for the rest of your life and expect to have healthy teeth, right? Maybe you get lucky enough that, I don't know, maybe your parents and grandparents and great-grandparents ate well enough that they strengthen your genes to have good teeth, but it's like, man.
Oh, let's talk about that. Okay, so we're talking about like, we're talking about in other countries and how their teeth development is, okay? So my dad is from the Dominican Republic, and my dad growing up there used to be these drinks called Malta. They're like, they're like soda
it's like
drinks.
A way that you get kids
like
addicted
syrup,
to beer.
Yeah, it's syrupy.
Yeah.
Anyways, but he would open the top with his teeth.
Yeah.
Like, it was just normal. He'd be like, just pop it open with his teeth.
Teeth are so white, though. I mean,
yeah.
pristine.
And he used to like bite into bones. So he grew up in the Dominican Republic and came here in the 70s and 80s, and it's nuts to think about.
Yeah.
I mean, people wouldn't be able to do that here. They'd be like breaking their teeth. But he grew up there. It was just.
So then, when somebody said, "Well, isn't that genetics?" Well, yeah, but you have to look at it from environmental. It's called it's the genes you are passing down to your kids over and over and over again. Guess what influences
genetics.
your genes?
Why can't I open up bottles? I can't do that.
Right, but guess what it is? Epigenetics, right? Mm-hmm. It's your environment controls what genes are turned on and turned off. And it's not an opinion. It's an absolute fact. It's something that we've proven over and over again. Your environment influences your gene expression, which means that if your environment influences your gene expression, it's going to actually affect the genes that you pass down to your kids, which affects the genes that you pass down, that they pass down to their kids, and so on and so forth, which is why you can actually see things like, my great-grandparents never saw autism. My grandparents never saw autism. My parents, they maybe saw one or two people with autism. My generation, I saw a few people with autism. Now my kids' generation, everybody's got autism, right? It's why. It's because, again, these genetic factors get passed down from environment. So change your environment. That's the good news, right? You can actually do it. And so I know that we gotta go on a break because we are doing a 2-hour show. So if you're not with us in the second hour, I don't like you. I'm gonna disown you. No, I'm just kidding. I'm not gonna do that. But we've got so much more that we want to talk about that I think is going to be absolutely amazing. But before we do, I wanted to just mention again, our community partner, if you live in Chattanooga and you are seeing any other dentist besides Smiles of Chattanooga, it's time to change. Because they will, again, they're going to work with you so well. Just tell them when you go in, you say, hey, I heard you on Doctor's Warren, I heard about you on Doctor's Warren, and they will set you up with a good
That way, if he doesn't
patient.
do it good, I'm going to be like, what the crap, dude? That's not going to happen.
That's right.
But guys, this is the Wellness Radio. For the second hour, we're going to be answering your thyroid health questions, thyroid disorders, thyroid symptoms. So tune in and find us on Facebook at Doctor's Warren.